Well, before I get started, I always start with a few breaths. So I put on one hand on my heart, one hand on my belly, and we can just take a collective breath. So in through the nose and a long exhale through the mouth. We'll do that a few more times. Inhale and a long exhale. Now solely through the nose. Inhale for 4. And a long exhale through the nose for 5. Well, thank you for joining me with this breath because I feel it just kind of gets us right away in a heart coherence, as I know we're going to dive into and cover so much together. And I'm so honored to have you on today, Dr. Gandhi. It was such an honor to meet you in cons, and there's no coincidence that we met there. That I know. We had started talking, and I think we could have talked for hours.
I agree. Yeah, there's no coincidence. We definitely met for a reason.
Yeah.
Appreciate
So
it. Yeah.
I want to dive right in. I want to dive right in
Yes.
and hear more about you almost died twice. And I truly deeply feel this is the big why my husband died. The mercury poisoning, the toxic load in his body. And I think I need to hear more stories like yours from dentists to encourage
Yeah.
other dentists to do a test that is probably under $300 to really
Yeah.
see where they're at. So I'd love to talk about years before you found out you had mercury poisoning. What were those
Yeah.
quiet whispers that your body was
Yep.
showing signs? I want to know, what are those little signs in your body?
Yeah. Yeah. Sorry to hear about your husband. I mean, when you told me, I was like, oh my God. It's the craziest thing because we see it so often in our community, and sometimes it's too late to help a person. And that's like your mission and my mission align. Like, I want to make sure dentists are detoxing themselves, especially we're helping patients detox, but we're not doing it ourselves, so we're causing more harm. And we got to take care of ourselves first, and that's the biggest point I want to get across to a lot of dentists. And that's why I always talk about it. I share my test results. I share my here, this was my testosterone before, this is after, this is what I did, because it's super important. And everyone's toxicity load is different, right?
Mhm.
And so for me, what was experiencing in 2023 is when I started noticing differences, right? Like I was forgetting things. I was like, hey, like I'm having these neurological blocks, and these blocks were just weird. Like I'm doing a surgery, and all of a sudden, like I have a vivid image in my head repeating something that I was on stage at when I was 5 years old. And then I had to confirm it with my dad. And my dad was like, yeah, here are the tapes. He had all the VHS tapes and all that stuff. He's like, yeah, that was you at 5 years old. You had the violin and you were doing this. And it was like a vivid memory. But I'm like, when I'm doing surgery, why is this happening? Right.
Mm.
Then I started forgetting things, and it got really bad in March of 2024. And that's when my staff was like, hey, you got a problem. I'm like, what are you talking about? Like, you're forgetting to get a patient numb. You're just forgetting things. And like, how long has this been going on? They're like, for about 6 months. And
Because
I was
you're an
like,
incredibly bright man. So,
thank you. Yeah. I was like,
so when
how?
that starts happening, because that was my husband said too, I said he was the brightest
Yeah.
man. So when those
Yeah.
shifts started happening, I was like, wow, I'm not recognizing who he is.
Yeah, and that's what my staff. I was like, wait, and some of you guys, some of my staff have been with me for over a decade. I was like, what's going on? Like, we talk about everything. They're like, we just didn't know how to approach you and I'd tell you, like, hey, this is what's going on. I'm like, no, tell me. Like, we're friends. Yeah, we work together, but we're friends. Tell me what's wrong. They're like, yeah, you've been forgetting a lot of things. You get agitated. You're just off. It's not you who we've known for years. I'm like, okay, there's something wrong now. If they're telling me that,
Yeah.
my wife is like, hey, there's something, but we couldn't connect the dots
That
together.
takes courage though from your staff.
It
'Cause
does.
I
I give them a
think
lot of
a
credit.
lot of people
Yeah.
like they want to tiptoe around it. They don't want to make you feel bad. And
Yeah.
they're like, well, it's not always like that. So people, I know for me, that's what I saw sometimes with our staff, or they would come to me and mention these things. Or even for me, I kind of kept it. I'm like, well, it's not always the same. Or I would mention it to him. So luckily also you were allowing to receive that information, right?
Yeah. Yeah, because it's like I don't want to be that person because I've seen people with toxicity, but I still couldn't put that whole connection together, right? And I was like, okay, I don't want to be that person. Like, there's no way. Like, I need to get help, and it's coincidence, and I think everything aligns for a reason, right? And at that time, Gary Brucka released a podcast with Dr. Pompa, and I watched that podcast and I called Gary right away. I'm like, hey, whatever Dr. Pomp was talking about, and I didn't know who he was at the time, is exactly what I have. Get me in touch with him. Like, I don't care what it is, just put us in a group chat together and then I'll take it from there. So I spoke with Dr. Pompa right away and he's like, yeah, you have mercury toxicity. Like, this is literally the signs of it. He's like, I was there, you're just very deep inside of it. I was like, okay, how do I get help? Like, he's like, talk to one of my team members. I'm like, no, you walk me through it. Like, I need you to guide me through it. He's like, I don't take on clients. I'm like, you're taking me on. Like, I don't care. Like, I need this resolved. I'm young. I have a lot of people to help and I can't go down this hole and be sick. Right.
Right.
And internally,
You're
right?
lucky that you had those people on speed dial because you would have probably gotten lost in the system.
100%.
And because that's what happened to my husband. He's like, okay, went to a doctor. Like, nothing wrong with that. But it's just, then it was just, let's treat the symptom. And that's how opioids got introduced, nerve damage, medication, antidepressant. Like, it just got lost in a system and that spiraled into addiction and other things. Right. So you are so lucky that you had Gary. And in fact, it's interesting that you mentioned Gary Brecka because I met him last year and he's the one, I gave him all these things that I was able to tell them about my own family, about the brain scans I had done, the different things about my son in particularly. And at that time, he's the one who directed me to go get mold testing, parasites, and heavy metals. And I went home right after he told me that, and we were all in the red in those things. And so that's why I'm like, it's who do you ask? You got to ask the right people. And we're lucky that we're in a circle of health experts that will speak truth about these things.
Correct. And then it's just taking action, right away, right? Not waiting on it because there's a lot of stuff out there, but it's just like, okay, well, I've been through it. I went through it. Just like, let me quarterback it. That's why I tell patients, let me quarterback your health. Give me 3 to 6 months and I'll help you. I'll guide you along the way and then you'll get better. Right. And that's why I was fortunate to have these guys on my team.
Is there a particular test you recommend for, for heavy metals right now? I know there's one that I recommend. I just recommended a dentist that has out in Michigan this week. I said, it's worth it. Just get it done.
Yeah, you can do the try test, right? Okay. The try test from not Upgraded Formulas, other company. I forgot the company's slipping my mind, but it's called the try test.
Okay. I think I've used like Rupa and Mosaic. There's different ones.
Yeah, and there's DMPS, the chelation test as well, the provocation test, because that will also help. Right. Because it's also like when we think about it, there's mercury, there's tin, there's titanium, there's aluminum in the air. There's a lot of metals that we're exposed to.
Yes.
But it's one of those things where, it took me a whole year to finally like detox my body. And it was the wildest experience. I worked throughout the whole thing. And, at one point, my whole skin, like I'm dark already, I'm brown, I'm Indian, right? So my skin was yellow. I was like, you never seen an Indian person yellow. Like, I'm like, this is wild. And my eyes were just yellow. And I called Dr. Pompa. He's like, yeah, you got to stop. Like, you're just detoxing too quick. This is bad. So then, he guided me through it. And that's the thing. You need guidance, right? Yeah. You can't just do the protocols. Here you go. And then there's no one guiding you. Then another time, my fingernails turned blue. So I became cyanotic. Right. Wow. I did a procedure for a patient, removing metal, using the SMART protocol, doing all that stuff. And then my fingernails turned blue. So I called Dr. Pompa. I'm like, hey, what's going on? He's like, yeah, you got a problem. Go breathe some oxygen. Wow. Because it was just stuck in my body. So those are two like real experiences. And being all yellow, that's hepatic, like liver toxicity. My liver
Yeah,
couldn't
because your
tolerate it.
body couldn't detox fast enough, get it out, right? And
Yeah.
I've seen that with
Yeah.
my own son. He get the Hexheimer reaction, right?
Yeah.
And it floats in there where to the point he'll sleep for 36 hours. So he
Right.
can't, and a lot of it, I don't know if you ever done the MTHFR gene test.
Yeah. Yeah. Yeah.
And
Yeah.
do you have that gene? Because I know,
Yeah. I had the MTHFR and then
okay.
the MTR gene. Yeah.
Okay.
Yeah.
So then for people listening, that just means that you'll have a slower time to detox. Right. So it's
Correct. Yeah. And
important to know these things because
oh,
not
100.
everybody will be able to detox naturally. Some of these heavy metals are easier. And you'll be like, well,
Yeah.
why is it affecting me or one or the other? Well, it could be because you have the MTHFR gene.
Yeah, and the wildest thing about the MTHFR gene, like growing up, like and that's where Gary and I met. We met in 2018. We became very good friends, and he's like, "Hey, look, like let's do the DNA test and I have the MTHFR mutation." So I never laughed. I was never like a never happy guy in my life, right? I get all these war certificates, graduate top. I never cared. I'm like, oh, whatever. Move on to the next thing. And so he's like, you need folate. You're missing this. That's your key thing. So I started taking it, and 3 days later, I'm on the sofa. My wife and I were watching a movie, and I started laughing. She's like, "You're laughing," and I'm like, "No, I'm not." And I'm arguing with her that I'm laughing. I had no idea because I didn't know what it meant to be happy. Like I had
Hmm.
no idea. And this is like going back to 2018. So what was I? I was 34 at that time. I had no idea. And I'm like, this is weird. It feels good, and it definitely. So then I started taking the methylfolate, but then you start hitting these roadblocks, right? And then recently I did the SNP nutrition that we spoke about, that
Yes.
SNP test, and they formulate my and again, I have no affiliation with them, but they formulate my supplements for me. And I needed more. I needed like 108 times the amount of B9. So I needed a different version,
Yes, I
methotetrahydrofolate.
looked them up. So they test your
Yeah,
DNA, which that's one
correct.
thing that I'm doing next with my family is genetic
Yeah.
testing the DNA. What are you working with? And I
Yeah.
love what you sent to me because then, yeah, then it's, you know, exactly what you need for your body.
Yeah.
We're each equally built, created
Correct. Cause
different.
yeah, 100%. Cause I was thinking, cause when you did the original, and these were only like what we were working with what we had back then, right? In 2018, this is what we had. 2019, this is what we had. And now 2026, we have a lot more that's available to us, right? Because they were not custom vitamins and minerals back then. No company was doing it. And Snip deep dives into, they do like a 12 version of the methylfolate or MTHFR, like that methylation test, and they found a lot. They went deeper into it, and like I was taking close to 25 milligrams of B9, but that was methylfolate.
Mhm.
And what they said that you need methotetrahydrofolate. So it's a whole different version of B9,
Yeah.
right? But it works so much better, and I feel the difference, right? And that's the cool part about it. So now I don't need to take a lot of all these other supplements, and that was the crazy part. It's like, and we'll deep dive into like
Mhm.
what my whole detox pathway and how I got here. But I was taking like close to 60 supplements a day. It got chaotic.
Yeah.
It's like, how do you handle that?
I
It's
know. Well,
like
no,
my
you should
wife's
see
like,
my pantry. I do.
yeah,
I'm a supplement
yeah,
junkie. But at the
yeah.
same
It's
time
insane.
now, what you need to take for your body, what's, you might,
Exactly.
yeah.
And now it's like under like two main ones, and then I take a few extra ones just for longevity health, right? So now I'm down to like less than nine, like nine around, or less than 10.
Yeah.
So it makes life a lot easier,
Absolutely.
quicker. Traveling is easier. But yeah, it gets a little chaotic because we're told, hey, take this, take this, take that. It's going to help you. But can your DNA tolerate it? Now, if I had the DNA test prior to starting this whole metal detox, it would have been much better,
Yeah.
right? Because then I would have detoxed a lot better. So we have the technology now, so but you just got to do it the right steps, right?
Yeah.
And that's the biggest thing.
Did you also have for a symptom back to the mercury, like the numbing of the hand, the fingers?
Yeah. So what was going on was I would get like the numbness across the elbow, like the shoulder itself. But when I was doing surgery, like like I'm a righty, so I bend a little bit. My neck bends to the right just for visualization. I get these little ticks, like my neck would just go like that. I'm like, this is weird. Or like I'm concentrating, and all of a sudden my goggles would like flicker. I'm like, this is weird because like I would get those jerks. And then I had the memory problems where my nerves would just like, I would just have these thoughts and I couldn't get past those thoughts. And they were all just memories, and it
Mhm.
was just neurological. It's a neurotoxin, right?
Yes.
Mercury
Yeah.
is a neurotoxin. So it was just those blockages I was getting. I'm like, this is a problem. And I mean, I grew up, my mom was a dentist, so she had metal all around her. I grew up with metal in the house, like mercury in the house. It was like mercury balls. Back then you were mixing it, and even in school, right?
Yes,
School
yeah.
is not now when you go to the dental school, it's all high tech. There's all this other stuff. But back then it was just a room. It was one entry point or two entry points, and it's a room. The ventilation was probably horrible. We're all drilling. Some people are drilling it dry, so you're getting it infused. And just for me, like my body just didn't tolerate it. It was just too much buildup very quickly. The human body can tolerate a lot of toxins, but when our bucket overflows, and mine was just overflowing, and that's when it started happening.
It started happening. Well, I'm so
Yeah,
glad you had the right direction right from the beginning. And is
yeah,
it during the detox process that you said you nearly died twice? What?
correct.
Yeah.
Yeah, that was it with the liver, the yellow eyes and the liver going haywire. Like I would
Mhm.
just pass out, and then on top of that, the fingernails turning blue.
Wow.
Right, that was a big problem.
So is
Yeah.
that something you test regularly still now as far as the mercury
Yeah,
and heavy metals?
yeah. So I do the DMPS test, the chelation test, and it comes very low.
Okay.
Yeah, which is nice.
And so
Yeah,
now you've probably encouraged other health, dentists to do the same
yeah,
test. Do you get a lot of
correct.
pushback, or I don't need this, or I
Oh
don't
man,
believe this? Because I know I do.
most don't listen. Most don't listen. It's incredible. They don't listen. Yeah,
Mm,
we're in this field, and it takes a lot for them to actually. I think you have to experience a sickness, and
mhm.
then you'll do it.
Yes, yeah. I
Um,
can't unsee the truth. I can't unsee
yeah,
all the symptoms my husband
yeah,
had, and I sat by his bedside. I found him in his last days. It's
yeah,
like I cannot unsee that truth. And now
yeah,
more and more that I have dentists like you on, I have Dr.
yeah,
Michelle Jorgensen that shared her
yeah,
story, and I can unsee the truth. And so that's why I
yeah,
stand so strong. But when I am sitting beside a dentist and say, "Hey, have you ever thought of,
yeah.
testing for that?" And they're like, "Oh, that's not, no, it's not
Yeah,
true."
it doesn't exist. I know. I get that all the time. I get that from dentists all the time, and my buddies too. And then I was like, okay, you just got to hit a wall, and when you hit that wall, that's when you're gonna do it, right?
Yes.
It's not to get religious, but it's like when you read the book of John, and it says, one of the disciples, he had to when Jesus resurrected, he didn't believe it. He had to touch him, put his finger in the hole. I think it was Thomas. He had to put his finger in the hole and then put his finger into the body to see, right?
Yes.
So even though we're out there talking about this, it's until you hit that wall, until you come to that realization that I don't think anyone's gonna really, um,
Be open to it, even though it's an
yeah,
expensive test. And now, if the dentist that said yes to doing the test, do you find a
yeah.
lot of them are coming up high in heavy
Oh,
metals?
100%. Yeah, they're coming up high. Their significant others are coming up high. Here's the
Yeah,
kicker for you.
explain that. The significant
Yeah,
others, because I
yeah,
found my son was high in mercury, so I found out that it's epigenetic. So
yeah,
and also
uh,
Scott, my husband Scott's dad was a
yeah,
dentist as well. So
yeah,
and Scott, I remember him saying he was playing with some of the metals in the dental office when he was a young kid. So it's epigenetic, and then
yeah,
it was passed down to my son as well. And
yeah.
and you mentioned that you were exposing your wife. So explain that
Yeah.
as well.
So my wife, when she did her chelation test, she was 10 times more with mercury toxicity than me. So I was like, "Are you eating fish, like tuna fish, all day long when I'm not home? Are you eating out of the can?" She's like, "No, I'm not eating." Like, she's like, "I like tuna, but I'm not eating it all day long. So how are you 10 times higher than me?" Right? On the chelation test. And, it's empirical data, but there's no data behind it. But how did she get that high? It had to be early on from just skin to skin contact because it's honest still, even though you take all the protective measures.
Yeah,
Early on, I
are
didn't.
women more susceptible? Because I know I've heard higher
Yeah,
testosterone makes you less susceptible, to or able to detox. Is that what it is? If you have more testosterone,
correct. You can detox better,
better.
right? 100%.
Mhm.
But when it comes down to it, I think women detox a lot better. Just when you think about it with pregnancy, right? So what does a placenta do? Placenta takes everything from you and give it to your newborn,
Mhm.
right? So then you feel good, but what did you just give your newborn?
Yeah,
All the toxicity load, right? So
exactly.
I think,
Oh yeah.
yeah, I think women detox a lot better than men, but it just there's all these blockages that we have.
Hmm. Okay, I
Yeah,
love that. So you bring that up because I do talk about that in my latest book, The Gut God Connection, because I dive
yeah,
into the gut, but the gut journey from birth. From we
yeah,
set our nervous system in vitro, and it's all of our toxins on both sides, mom and dad, is passed down.
Yeah.
And so that is heavy metals as well. And how do you think we can inspire other healthcare professionals like dentists to really just try to open their mind to
Yeah.
this is probably affecting them? If they're removing amalgam still to this day, or then it's to why is there fear to know seeing that truth? Is there times, like, for example, maybe a better question, a time in your career where you started seeing these truths about maybe cavitation, root canals, these amalgams,
Yeah.
but you weren't ready to
Yeah.
accept that?
Yeah, I mean, you got to do it to a loved one, right? So for me, at that time, my girlfriend ended up doing 2 root canals on her, and it was the upper molars, number 3 and 14, and this was in 2012. And then she complained for migraines for 6 years, right? And I was like, no, no, it's not the teeth, not the teeth. We had it checked out by specialists, other colleagues. We had it all checked out. Everyone said it's fine. X-rays 3 and 14 are right below your sinus, right? The maxillary sinus. So if there's an infection with the root canals, then um, the sinuses will be involved, or you see a gray shadow. So as a dentist, I'm like, oh, I did the best root canal ever, right? Everything looks really good on you. But her body couldn't tolerate it. For 6 years, she had migraines, and it came to a point where she's like, either you take it out, or I found someone, I'm gonna go get them taken out. I'm like, wait a second, no, like I'm gonna treat you. I treat all family members.
Yeah, your identity is a little bit hurt,
But I'm not gonna let you go somewhere else. So I took
Yeah.
them out, and migraines went away. I was like, okay, but something inside of me, it was an innate ability inside of me of knowing what to do with bone, just cleaning bone. I know it sounds crazy. It sounds just the weirdest thing, but it's just something since 2009. Once I graduated dental school, I got into residency. Just something about cleaning bone. I just knew I had to look a certain way. And I had to do whatever it took and whatever modalities I had at that time to clean the bone really well so it would bleed properly. And then the patients would heal. And I was like, okay. So I took took the 2 root canals out, and then grafted the areas, did everything, and then she healed really well, and she migraines went away. I'm like, okay, now I need to go down that rabbit hole. And then once I went down that rabbit hole, I haven't come out of it.
You
Right?
couldn't
It's been
unsee it. So did you stop doing root canals after that?
correct.
Yeah.
Yeah, stop doing root canals, stop doing the titanium implants, graft everything, cleaning up the bone really well, using the ozone, lasers, and ultrasonics. Just incorporated everything I've learned. And then from mentors and from other healthcare providers, like, okay, this is what we're doing. And it's a whole combination approach. So it's not only dental, we're taking care of the gut, we're taking care of the whole body as a whole. Before we so if we're having a consult today, the surgery started for you today. It didn't start for you the day I see you or the day I make an incision inside your mouth. It actually started the day we spoke, because we're switching your whole mindset around, and we're actually getting you on a whole nutrition plan and guiding you through the whole process. Because some patients aren't ready, right? And that's what she helped me go down that rabbit hole. And again, it comes from a loved one. Like when you start seeing things that you've done to someone who's very close to you, like, okay, what's going on here? You start
And you
questioning.
knew you did everything right. Like you said, it was a
Yeah.
perfect root canal. And you know what? I saw that with my husband. He was general dentist, but he loved doing root canals. And so he prided himself. He actually was teaching other dentists his tricks, and he had thought about going into endo. But I remember as a hygienist, because I would, work alongside with him, that we'd have patients going, it still hurts. It still hurts. The infection wouldn't go away. You talked about migraines, headaches, and just that pain. And now I'm like, it clicks. It's like, oh my gosh, we never thought about, leaving something dead in the mouth and what it harbors and what you saw and the bacteria. Like, I know you shared a picture with me about this tooth that you're extracting and the parasite. The parasites. And so it's a breeding ground for all of that. And I know that's really hard for other dentists to really come to that truth, but until maybe once you see it, you can't unsee it, and it's okay. There's other option. It doesn't make you wrong. Like your identity didn't say, oh, I'm a terrible dentist, right? You just pivoted. How can I,
Yeah, I mean, again, there's nothing wrong. Like, if you want to do a root canal, just explain to the patient, right? And there's a reason for them, right? If you have an acute pain, we have to get you out of pain. Being in pain is a problem, because then you're in sympathetic overdrive. You're in that fight or flight mode constantly. We have to calm the body down. So some patients, you got to do that root canal and then come up with a plan. Like, okay, this is what we want to do. These are your options. Here's A, B, C, D, and E. And now you have all that information. It's your autonomy. You make the decision, right? So it's like, I'm just here to explain to you and educate you. These are all the ways we can approach this one tooth, and you make the decision, right?
Right.
Because I can't tell you like this is completely bad or this is the worst thing, right?
Right.
Because that's when, root canals are still going to be done. They're always going to be done, but it just depends on the patient, right? Some patients come in saying, I don't want that. I know what can happen. Okay, you're educated on it, but that's still an option here. We're going to still give you that option. You don't want to do it, then that's fine. Then let's move forward to the next option for you.
Okay, I like that. So it's never, I like where there's not black and white, but let me give you all the information about it and what we know now.
Exactly. Yeah, because you need to be educated on it. You need to also know what you're getting yourself into, because it goes back to like setting up the patient, right? I always say it's a triangle, it's a pyramid, right? The base of the pyramid is always diet and nutrition, fitness, right? If someone's not going to be doing the diet, nutrition, fitness, then don't be taking teeth out on them because they're not going to heal, right?
Yeah.
80% of it, that's the base of the pyramid, right? Then detox the body. Naturally, your body's going to detox, and that's the next part of it. Then dental comes along because dental is like a cherry on top. It's like, okay, it's going to fix the interferences that we have. Then you take supplements, peptides, and then all of a sudden you see your hormones are working perfectly fine, right? Because you got rid of all the blockages. But if you're not going to take care of the diet, the nutrition, and fitness, then what's the point of doing all this dental work?
And
You're
so I
spending
love
money.
that you bring that up. And I love that's how you
It's a
care,
waste.
because I
Yeah.
see that for the nervous system. I always see the nervous system, diet, for sure,
Yeah.
and the gut health is all correlated,
Yeah.
because if you are in, I'm sure you see it, if you have a patient that is in the sympathetic nervous system, that fight and flight,
Correct.
it's a breeding ground in the gut for acid
Yeah.
reflux, for actually parasites thrive in
Yeah.
that type of energy. And
Correct.
it causes that leaky gut where parasites can enter. So creating a nervous system, it's almost like calm the nervous system on a regular
Yes.
basis, so then they can heal. And also in the sympathetic nervous system, patients have a really hard time committing to that next step. They're already
Yeah.
overwhelmed, right? I'm
Yeah.
sure you see that. Like, you give them a lot of information, and it's almost,
Yeah.
you have to work on their nervous system so they can accept that first step.
Yeah.
And those baby steps of changing the nutrition, and and then because you see it in the mouth, like, what do you see? I always say the mouth is the mirror. When I look in a mouth, I see the amount of stress, emotional suppression they've had over years, some of the
Correct.
medication they've been on, it's
Yeah.
just their whole lifestyle. I see it
Yeah.
without even them telling me the truth,
100%. It's the same. It's the same exact thing. It's like you give me an X-ray, I already know what's going on with the patient, right? I can paint the picture without even talking, even mentioning one word to the patient,
Yes.
and they're always surprised. It's like, how do you know all that? So I'm like, your X-ray tells me everything that's going on without you even telling me a word, right? And you're 100% right. How do we break that sympathetic, that fight or flight mode, right? When we have these interferences, right? Biological dentistry, I try to keep it simple. There's a lot of woo-woo stuff out there. And I was like, when patients see me, do you do this? Do you do this? No, I keep it very simple. 5 very simple things I'm looking for. Do you have any metals, right? Metal fillings, metal crowns, metal implants. Do you have a tooth that's missing? Were you born with a tooth that's missing, or do you have a tooth that was taken out? Right? There could be something a problem in the bone. Do you have a dead tooth? Whether that's a root canal or an injury, boxing injury, airbag injury, some injury. Is a tooth discolored? Is it necrotic? Then we look at the bite. Want to make sure the bite is adequate. Not telling every patient to get a perfect bite. Is the bite adequate that you're not causing trauma? Then the oral gut brain connection, right? Because the teeth are the middle ground. Above it is the brain, it's upstream, and below it is the gut, it's downstream, right? So everything's metabolic. So we look at those 5 things, and if any one of those things are off, we're going to take a look at that area, right? And to keep it even simpler, think of like you have 32 teeth, so you have 32 circuit breakers. If one of those 5 things are off on one of those, that circuit breaker's off. What do we need to do to fix that, to turn that circuit breaker back on? Because we turn that circuit breaker on, everything's going to flow and the body can heal them. So as a dentist, keep it very simple because we don't want to step on the medical side of things, right? But it's important to work with our functional medicine colleagues or any medical colleague. And they're always surprised. They're like, hey, how did that happen? It's not like a miracle. It's very simple. We just address those 5 principles and now the patient's healing.
Is healing. Yeah, I love that you mentioned that, because that's every tooth is part of the meridian, right? And
Correct.
connected to
Yeah.
an organ. And I think one that's often overlooked, especially for cardiac disease and cardiac arrest, is
Yeah.
connecting it back to a tooth. that might have been
Exactly.
infected. I
Yeah.
have many stories of, oh, somebody was completely healthy and died instantly of cardiac arrest. And I'm like,
Yeah.
I would love to see their mouth.
Yeah.
Love to see if it's correlated back. I've had many that said yes, they had infection in the mouth and it
Yeah.
created cardiac arrest. But then again, that's kind of taboo, right? They're never
Yeah.
correlated, and that's why I'm a big advocate. If you're starting to have symptoms, let's look in the mouth
Yeah.
first, right? Come to
Correct.
someone
Yeah.
like you, and that has the whole body aspect, because
Yeah.
you look at the guy, you get people on Parasite. I talked to Jeremy. I
Yeah.
know he's coming in for surgery
Oh, yeah.
here
Yeah.
soon.
Yeah.
And actually, one thing I found out working for a biological dentist, I have cavitations as well. And that was a hard
Yeah.
truth to take on. And I know I'll have to come see you. But
Yeah.
what you put people on is parasite cleanse, correct?
Correct. Yeah.
To start
Yeah.
off.
So with my team that we work with, we have medical doctors on my team, and we get the patients on some form of antiparasitic, antifungal, and sometimes if they've had Lyme or some symptoms of Lyme, antibiotic that can deal with that. Yeah,
Mm.
because we want to prep the patient. So I believe in pharmaceuticals. I know there's a lot of my colleagues who don't believe in it. They're like, you can't, you could just put it in the IV and all that stuff. Like, no, we need to prep the patient. Unfortunately, Americans are very sick, and we're dealing with a lot of disease. Because you can see it like all week long. It was surgery after surgery this week. It's 2 to 3 surgeries a day. And you can see how sick the patients are. And then the next day, they're like, oh my God, I feel great. We just
Wow.
took out
The
13
next
teeth.
day, just from
Yeah,
the,
13.
wow, big
Yeah,
difference.
even a lady who came up from North Carolina, we just took out 13 teeth on her yesterday. And today she's like, I just feel amazing. Like, I feel
Wow.
good. Hardly any swelling because you're following these protocols, right?
Mm.
And that's where pharmaceuticals are very important, because if not, our body can't eliminate them, right? We need to pee, we need to poop, we need to sweat. If we're not doing those 3 things, we're not going to get the resolution, right? And think about it, like from here, where's everything going to go? Hopefully downstream. If it goes upstream, you're in trouble, right? If it crosses the blood-brain barrier, then
Yeah, because
you're
right
gonna
now we're seeing connection with Alzheimer's, dementia,
yeah.
the same bacteria that's in the mouth, we're finding it in the brain.
Yeah, 100%. And when we do the DNA connections, the test itself, we see the Profilomys gingivalis, right? That's what they connected with Alzheimer's and Parkinson's, right? And why is it such a, like, like you go back 50, 60 years, this wasn't a problem. So what were they doing back then, right? That's what we need to look at and then
Mm.
figure out, hey, what happened to us,
Mm.
right? And that's the important part. And you speak, yeah, talking about Jeremy, yeah, exactly. I think he didn't have wisdom teeth there. And it's like, no, you have problems. So we took the 3D scan. I was like, look, you could see these dark areas there. And look, we're going to send this out. We're going to send it out for a Lyme panel, the DNA panel, a Rantes panel, and then also we'll send it out for a mycotoxin test. And let's just see what is all stored in the bone,
Mm.
right? And this way, other colleagues will understand, like, hey, if you're born without a tooth, there's still a problem, right? Just put it this way: if you were born without an eye, medical emergency, like you would run to, like, hey, what's going on? Born with 1 kidney, it's a problem, right? Born with only 4 fingers instead of the 1 is missing, problem. But why is it not, oh, you're born without a tooth, it's just a tooth? It's not a tooth, just a tooth. It's an organ,
Mhm.
right? There's a nerve, artery, vein, lymphatic drainage, and function that defines an organ. So each tooth is an organ.
Right.
So if you're born without it, what's going on inside the jawbone? What's being stored there? And we're, of course, exposed to a lot more environmental toxins than ever before.
Yeah.
So are they stored inside there? Yeah. And then, yeah, I showed you that picture of that parasite.
Mhm.
So the story for her dad is a dentist, and I met him at a conference, and this was a conference dealing with a lot of parasitic cleanses and everything, but he had no idea. He's like, hey, my daughter had her teeth taken out about 5 years ago. There's some little root tips in there. Can you take a look at her? I'm like, yeah, sure. She was on anti-parasitic cleanses for 2 years, so I was helping her build her body out. And then we ended up doing the surgery last year, July, and this thing was like, it's an upper right cavitation. And I talked to the patient the day before, just talking, but didn't mention anything to me because now I know why she didn't mention anything. But did the surgery. She's under sedation. Did the surgery, and I was like, hey, cavitation for me is easy to clean up, and I go in there, clean it up. It's more routine. And my anesthesiologist is like, you're a little frustrated here. I'm like, yeah, there's something in here. And my assistant, who's been with me over for a decade, she's like, what's wrong with you? I'm like, I think I'm losing my vision. And she's like, what do you mean? I'm like, she's like, like, and I'm recording it so they can see it on the screen. She's like, no, you got everything. I'm like, no, there's something there. It comes and goes, comes and goes. Like, I don't
Mm.
understand this. So I just take my goggles off and I walk away. And like, and they're like, you like, I'm done. Like, I can't. Like, if I can't see, then I don't want to operate on the patient anymore. You know, then there's going to be something that can happen and go wrong. But then I go back in there. I'm like, okay, let me just go back in there. You know, a unit at a time. Go in there. And I'm like, okay, let me just pull on that. What I see there, I grab it, and it was this long worm that
Wow.
comes out of her. Right. And I was like, okay, now I know what was messing with me. But she was on antiparasitic for 2 years. Why didn't it kill the worm? Right. Because again, this is a contained field, right? Inside, even though the environment, our mouth is connected to the rest of our body, it was encapsulated.
Oh.
Right. So imagine what was going on for her the whole time. So I spoke to her that evening. I was like, hey, do you ever feel something going on? She's like, yeah. She's like, I didn't want to tell you something because then you thought I'm crazy and cancel my surgery. I'm like, that's happened to you? She's like, yeah, it's happened to me. I'm like, oh,
Oh no.
like now I know why. She's like, yeah, when I would get acupuncture on my right side, I would get very flush and red. I'm like,
Mm.
interesting. I was like, but and then she's like, yeah, I would always feel something crawling on my right side, like upper right side. I'm like,
Oh
I'm
wow.
gonna send you a photo, check your phone. And she knew it. She's like, I knew there was something wrong. You know,
Mm.
and that's the part where we have to learn to understand our patients. Just like yesterday with the we only planned around we planned 12 areas or 12 teeth that were going to come out. She's like, hey, can you take a look at this one other tooth? She's like, I just don't feel like there, I think there's something wrong. You could see some decay on it. So restoratively very easy, right? You could just put a crown on the tooth, right? And be okay. But she's like, no, there's something, I know there's something wrong with it. I'm like, okay, when we're in surgery, I'll take a look at it because I have the incision there. I could take a look deeper in there. So I ended up taking the tooth out. And when I took the tooth out, all the pathogen, all the decay inside the bone led right on top of her nerve.
Well,
And you could literally dissect her nerve, and I went around it and cleaned everything out. And that was the area which was not planned for surgery.
for surgery.
Her body knew it. So I've
Yes,
just
no, you're
learned,
trusting the intuition, right? That's my
yeah,
thing is like trust your body, learn to listen to it so much. And sometimes the mind has a hard time catching up what it is. Like she said, she
yeah,
didn't know, but she's
yeah,
felt the nudge to ask you to look at
100%.
that
Yeah,
one, right? There was
yeah,
something wrong. And sometimes we can't pinpoint it. That's how I am. Sometimes like there's something's off, but I can't, I don't know what it is, but I'll dig deeper and ask questions. And I love that that's how you do dentistry
yeah,
and really
yeah.
get to
Because
the
you
root
know your
cause.
body better. You know your body better than anyone else, right? And
Yes.
when something is off, like a tooth should not be sensitive. A tooth, if it's sensitive, you're in sympathetic overdrive or there's a problem with the tooth, right? So
Mm.
some patients come in, they're like, hey, my teeth are sensitive. Well, if all the teeth are sensitive, I know that there's a problem here, right?
Mm.
If one is sensitive, okay, let's take a look. And we brought up the meridians before. You know, in Western medicine, we don't use it as diagnosis, but we can use it as a reference tool, right? So I use it as a reference tool. And I'm like, okay, well, what's along that meridian? Is there a problem? Is there an issue? And if there is, maybe there's something else going on downstream or upstream. Let's refer you out to the right professional and let's handle that. And all of a sudden the sensitivity goes away on the tooth.
Oh.
So the tooth can be a warning sign as well. So
Mhm.
that's one of the things as dentists, if a tooth is sensitive, we jump in there like, oh, we needed to do work on the tooth. Let's take a step back. Let's really evaluate the whole picture. Why is that tooth sensitive? Why is there a problem there?
Yeah.
Right? Because the body can naturally heal and the tooth wants to heal too, because it's all connected.
Yeah, but what's the trigger, right? So you're trying to get to the
Exactly.
root. So for example, for me, I come back from the Texas Dental Association. I'm, talking, but I'm taking courses too. And I take this one about oral cancer. And I couldn't help but notice that every picture that was alongside some oral cancer that was found was these metal, the
Yeah.
metal. And I was like, for me, I was like, okay, the system is reacting to the metal in the mouth, but there's also other gut issues creating this acidity
Mhm.
completely in the gut. And so it needs to be talked about.
Yeah.
Every picture, there's something triggering. And
Yeah.
the mouth is showing signs either on the tongue, oftentimes I look at the tongue,
Yes.
are you
Yeah.
deficient in certain minerals or airway? Airway is a big one, airway.
Yeah.
I've done a lot of airway ish things for my son and just I think the mouth is more of a mirror than people understand and giving clues already to all your organs.
Correct. I mean, you hit it right there. The metal is a hormone disruptor, right? And
Mhm.
what is our stomach, right? You need enzymes to digest food. But if you have the hormone disruption, how are you going to get those enzymes, right? And now we have gastric reflux. So here, let's take these medications for it, but let's look what's above that. It's the teeth,
Yeah.
right? The gums are connected to the gut, and the gut is connected to the gums. It's all one, right? So if you have the metals in your mouth, or if there's any issues or toxins inside there, let's evaluate it and take a step further before and it's again, it's two roads, right? Some people want to go traditional route, go traditional route. Some people want to deep dive and like, hey, I don't want to be on medication the rest of my life. I want my body to heal. Okay, then let's go this route, right?
Yeah.
But you pick and choose. It's hard to find a happy medium, right?
Mhm.
And the biggest thing in the misconception is like, you treat one area, but if your whole mouth or majority of your mouth has a problem, think of your mouth as a 4-bedroom house, right? Each quadrant's a 4-bedroom house. You say, hey, I only want to treat this upper right area. Okay, we treat that 1 bedroom, right? So what about the other 3 bedrooms? So 1 bedroom is perfectly clean. Now you're a hoarder. Your house is you're this big hoarder. Your 1 bedroom is clean, but your other 3 bedrooms have rodents, have termites, have mouse, and all that stuff. They're gonna go to a clean room, right?
Yeah.
So that's the other
The
problem
cycle
too.
continues. Yeah.
Yeah, and that gets reinfected, and that's the biggest problem that we also face in the biological dentistry field, right? Some people think it's too aggressive. Well, is it too aggressive, or are we trying to get the patient healthy?
Right.
Unfortunately, it's a lot of repair work, right? And if the patient truly understands what they're getting themselves into and how we're trying to get them healthy, then we can proceed that way.
Yeah.
But you can't expect to clean one area and not leave the other area, because now
Mhm.
your immune system is is going to go after that area, right? And
Right.
now it's going to be hypersensitive, so you can't get healthy. And then patients like, oh, this stuff doesn't work. No, it does work, but you still have a mess.
Yeah, well, that's
So
why the gut connection, the mouth,
yeah,
we got to, work in it all. And it's not one quick fix. And finding somebody
correct.
like you. And I mean, not every dentist is like you. So how can we
Yeah,
encourage other
yeah,
dentists to be open-minded to this? Like, did you do a different, once you dove into it and learned it yourself, did you do other
yeah,
education that you can recommend? Other dentists listening right now, and they're like,
yeah,
okay, I'm starting to see this in my own patients. I want to learn. And it could be really
correct.
overwhelming for them
Yeah,
to overhaul their dental practice of how they've always done it, but they're open.
yeah. Yeah, I mean, we overhauled this practice, right? It was very tough to do that because it was traditional practice into more biological dental care. Shadowing is number one. Like, you need to go shadow, right? You need to really see it, or let a biological dentist who's well versed in this operate on a loved one, right? And then let's see the changes unfold in front of you. And once you start seeing the changes unfold in front of you, then there's a lot, right? Then you can do. There's so many education programs out there. I know one of my buddies from Germany, Dr. Dominic Nischowitz, we're working on the whole this biodentistry global standard to standardize this kind of care, because you've interviewed a lot of biological dentists, and you've seen there's a fork in the road, and the
Mhm.
problem is patients are getting kind of screwed up, excuse my language, because they're not getting the full care that they should,
Yeah.
because there's corners being cut and procedures that are being done not the right way. So there's re-entry points or revisions that need to be done. So that's what we're working on, standardizing the care for biological dentistry. So when patients go on, here's the link, you can find a biological dentist, they're qualified and they're well versed in this kind of treatment. There's different levels too, right?
Yeah.
So because the biggest thing right now is like, hey, I got a certificate. Like, I got a boxes full of certificates, and I don't hang one up. I don't want to, right? Because you can pay for it, you can get it, but that doesn't mean that you're qualified, right?
Yeah.
You need to literally be great with your hands. Like, and dentistry is an operator skill.
Mhm.
There's a lot of education that goes behind it, but you're an operator. You need to be really great with your hands. You need to have the didactic, what we call the software, but you also need to have the technical skills as well, right? You can't have, if you don't have both, then there's a problem.
Yeah.
And if you have one more than the other, then stick to that portion of it, right?
Right.
So that's the biggest thing,
And
and that's what
implementing everything you've learned, right? Because I know I
exactly.
temp, I float around. I mean, now I prefer working for Dr. Shreve, Dr. DeSanti, who are biological dentists here
Yeah,
in Gilbert. But I've temped other biological, they're not all the same. So
yeah,
I actually met Dr. Dom as well, the Health Optimization Summit, and got to
yeah,
talk to him. And I love what he's doing. And I do feel, I talk to even the students that are in dental school. I'm like, hey, have you
yeah,
heard about biological dentists? I
yeah,
really
yeah,
feel I'm part of that shift, bringing that
Correct.
awareness, and a lot of it, I'm trying to educate the patient. So supply and demand, more
Yes.
patients are asking for this kind of treatment, but also I want to inspire dentists to not be afraid to step into this realm. And I think you do get sometimes a little bit of pushback. I know I'm there talking about nervous system and bringing the science of it and why
Yeah.
it's important for you. I want to keep
Yeah.
you like sustainable, human sustainability to
Yeah.
do what you're doing, because it's hard to
Yeah.
be around that 6-hour long surgeries that you're doing all the time.
Yeah.
So working on your nervous system and making sure that you can sustain, you know,
Yeah.
providing this clinical excellence throughout your
Yeah.
career.
No, 100%. I started laughing because I remember I was giving a seminar once. I think it was like 300 dentists. I started talking about vitamin D, and a few of them started walking out.
Wow. Yeah.
I was
Well,
like,
I was
okay,
at the Texas Dental, so I was done my
I
speech.
was
I go
like,
to a speaker scout event,
yeah,
and I'm sitting beside this dentist. He's like, "Oh, you're the breathwork girl or whatever." Yeah, I
yeah,
breathe, and I'm like, "Okay, buddy."
yeah, exactly. And that's the thing, and that's where that's where I take a step back. Is like, is it right to teach dentists, or just start talking about this
Mhm.
and let the patients and people hear this, and then they go back to their dentist and they're like, wait a second, and then the patients start questioning it. And
Yes.
when the patients start questioning it, now I did my job, because before I was trying to teach dentists and it was getting nowhere. It was
Mhm.
just push back, push back, push back. I was like, you know what, this is frustrating. I'm just going to stick with what I'm doing. Patients flying from around the world, they're healing, they're enjoying their lives. I get the stories all the time. And I was like, okay, this is perfect. And then one of the patients I was talking to, he's like, you're very frustrated. He's like, I never seen you like this. I'm like, yeah, I was just giving a seminar, and this is what happened. And he's like, we the people. I'm like, what are you talking about? And we're just talking about guns and all this stuff. And he's like, we the people. I'm like, you're right.
Yeah.
He's like, what
That's
do
what
you mean?
I'm
I'm like,
doing with my podcast. I
yeah. I
think
was like,
today
I've been
I
talking
have
to
a
the wrong
guest sharing
people.
their dental story and sharing your knowledge. I have a woman next where she shares kind of her journey with biological dentistry, and it's
Yeah,
just empowering the
that's
patient,
awesome.
and the supply and demand. And I truly love because it's hard. My good friend is Dr. Preya. She's the whole tooth dentist in
Yeah,
Texas, and she's doing things very different, just like you. And
yeah,
sometimes it's hard for the patients to find the value in that because it's
hmm,
not covered by insurance or this and that. But
yeah,
I want to educate patients. There is so much value. Think of like where you want to be in your health journey 10 years
yeah,
from now, and this can be impacting your hormones. It can be
yeah,
impacting so much, for Alzheimer's and
yeah,
dementia. Where do you want to be? And the mouth could be, correlation to all of that. So yeah, it's just about
yeah. No,
awareness.
100%. And you said 10 years. I think I showed you when we were on the boat. I showed you a picture of me when I was 10 years ago, when
Yes,
I was
yes.
22. And I look way older,
You
and I
looked
leave
way
a lot of
older. You did.
yeah, I leave the photos up on the wall here with me and the patient. I'm like, I'm never gonna be that guy.
Hmm.
Like, detox is super important. Like, you need to get the parasites out of you, the mold out of you, the metals out of you, the environmental toxins, so you can have a good quality of life.
Yeah. And
And
unfortunately, like you said, we live in an environment that is becoming more and more toxic, even with
yeah,
the EMFs. And so doing these protocols on a daily basis is so important. I use the
yeah,
sauna. I have my PMF mats, the red light breath, and I'm very good with my nutrition for the most, for the
hmm,
most part. Use peptides,
yeah,
because I do feel
yeah,
they can help with the nervous system regulation
yeah.
and help
They
on
help as
cellular
long
level.
as you're detox, right? As long as you don't
Yes.
have a toxic environment, then they help.
Yeah,
But if
I've
you have a
noticed
toxic
that
environment,
actually. I've
then
noticed that.
peptides are not going to help you, because you got so much other things to deal with. And
Yeah,
like what
people
we
who get a
started,
lot of reactions, I've noticed that.
exactly.
Yes,
Yeah, and you
yes.
can grow things that you don't want to grow, right? With doing the
Mhm.
peptides, if you're toxic internally. So you need a detox before you do the peptides. And then
Yes.
peptides are just going to accelerate you and make you feel better and make you superhuman. But until you don't clean out your
Mhm.
environment, then don't wake things up that are going to wake up and
I know.
cause
I
harm.
always say people are always like, "What do you do? What do you recommend for Paris?" I actually
Yeah,
step back even more. I said, number
yeah,
one, work on your nervous system because if
yeah,
you're continuously being on this sympathetic and you start all these protocols, I've been seeing people get adverse reactions. Like if I put them right
yeah,
away into parasite cleanse, but their body is
yeah,
still in that fight and flight, they're going to have
yeah,
a lot of adverse reactions. So calming the nervous or alongside all of
yeah,
that really helps. I don't know if you've seen that with your patients.
Yeah, no, 100%. And I was gonna tell you the way we started the whole podcast with breath work. Oxygen heals, right? What are we using ozone for? What are we getting to the site? We're healing the site with oxygen, right?
Yes.
And oxygen heals. So if we can't breathe properly, that's why when the dentist was like, I breathe, I'm like, okay, you have it totally wrong, right? You just
Yes.
oxygen is what's helping us heal. Without oxygen, that's the root cause of all disease, right?
Yeah. Oh,
Oxygen
I've
keeps.
noticed it. I've been using the hyperbaric oxygen chamber. I use
Yeah,
hydrogen tablets. And
yeah.
just with me doing breath work, I see how it's helping me heal and detox, and same with my kids. And so it is so important to have that quality oxygen. And that's why airway is equally important.
Oh,
And
I agree. And what we find a lot with the airway is when we remove the toxins from the mouth, the patients first, they lose so much weight. Their whole skin, they appear totally different. And they're like, I'm sleeping so much better. Like, and all of a sudden they're like, I don't need this stuff. I'm like, well, you need to go to whoever prescribed it to you and talk to them about it because I'm your dentist. I'm not the one who prescribed this to you. But you look so much better. You're breathing better. You have more energy. You're gaining more muscle, which is great. But then, talk to them to get you off of this or whatever you guys need to do or reduce the usage, right?
yeah,
So airway is huge. The biggest thing with airway, I feel like they skip that pyramid, right? The diet, nutrition, fitness, then the detox, and then they don't do that first. They go jump to the airway. You got to do the baseline
I
first.
agree. I
Because
agree.
without that baseline, and unfortunately, we live in a world where we want things so quickly, right?
Mhm.
People just want, I want this quick, I want this quick. So you want to just jump and do this, but you have all this other stuff to deal with.
Mhm.
Fine, this is gonna work for you, but you're gonna crash and burn again
Yeah.
because your foundation is not set. That foundation needs to be perfected and it has to be followed.
Yeah.
Right. That's the only way you're going to survive in this toxic environment.
Yeah, and we got to have the patience, like you said. Like for me too, it's at least a year journey where we're detoxing heavy metals, mold, and parasites, and it's still there.
Yeah.
There's still some things, but I was also noticing the conscious mind shifting the
Yes.
mindsets is affecting the gut, and because I've learned just from me, my own career and own environment of being in a toxic environment affects your gut. And also as a
Correct.
provider, you taking on everyone's fears, anxiety over time. Like what's your practice to not take those on? Because it's called mirror
Yeah.
neurons, the close
A
proximity.
hundred percent.
Because
Yeah.
when
Every
I
time you
was
mention
with,
that.
just an example, living with my
Mm.
husband when he was at a time, spiraling, addictions and neurologically, like I was almost like afraid because just wasn't thinking straight, and
Yeah.
buying all these guns, the security cameras, like he was just in panic almost. And
Yeah.
and so it created a lot of anxiety for me, and to the point I was eating clean, always exercising. I've always studied health my
Yeah.
whole lifetime. I feel, really being interested in it. I started having gut issues to the point where I just severe acid reflux. And
Yeah.
so I do understand the close proximity to environment like
Yeah.
that. And I take it on, it affects your
Yeah.
gut. So as a provider, for you to take on that stress
Yeah.
and fears that many patients have, what do you do to
Yeah.
protect yourself?
Yeah, so every day I have my morning routine and it's a strict routine. I don't leave the house. I use PMF, I use a sauna, and I have to get my workout in. So it's like and I'm drinking a lot of fluids. So I'm taking my salts, I'm taking my electrolytes and a lot of water before I even sit on the PMF, like lay on it. So I'm getting a lot of nutrients in me.
Mm,
And then the sauna, I'm sweating it out, then I'm peeing a lot. So I have to do the same things that I tell patients to do. And
okay.
by doing that, I'm constantly detoxing myself because these surgeries, I learned that from Dr. Jerry Tennant. He got really sick and he was a eye doctor and he got really sick because you're using a laser. I'm like, okay, well, I use a laser. And I have a thing of putting things together really quickly. I was like, well, I use a laser. I'm cleaning out the jawbone. These masks are crap. They're not protecting us. And if I use an N95 mask and try to work, I'll pass out because it's like,
The
these
oxygen,
surgeries for
yeah.
so long. Yeah. So it's like, and I need my goggles to see because I need to make sure I'm doing the best I can for the patient. It's very detailed, right? That's the technical aspect of it. But if I'm removing some of these deadliest pathogens known to man that are harbored in the jawbone, then I'm going to get contaminated. I need to detox myself. So every day I have to detox
Okay.
and just staying on my
So
supplements and
creating
just
like such a strong container, right?
have to.
Yeah.
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 And you can stack it. So it's like you can do a lot like breath work while you're on the PMF, like the Wim Hof technique, the box breathing. I do that when I'm in the cold plunge. So it's like the box breathing, do that a few times. It's my 3-minute mark that I could jump out, but you have to make yourself very resilient. But I do feel like if you have the right nutrition, which is diet, then your body becomes very resilient when you do these things additional, because the fitness keeps you intact and you
Yeah.
can do a lot more. And that's one of the reasons why I could do surgery. Like this week was insane with surgeries, but I'm still going and I could keep going.
That you can keep going, which is so important. We got to keep you going, and
Yeah. Yeah.
because
Thank you.
I know they're not dentists are not all the same at this point,
No.
And my big passion is to bring that awareness to dentists, and if they're starting to feel, the numbness or, more forgetful, because oftentimes those are like, well, I'm just getting older, or I have,
Yes.
I'm
Yeah.
busy, I'm stressed, I'm this, so they just kind of those small little signs, they're like, oh, I don't know. They put it to the side, but it's worth looking. And I encourage other dentists to maybe be open-minded. Maybe go, like you said, I love shadowing, shadowing another biological dentist and start learning about maybe incorporating this into your own practice, because I know patients are starting to ask for this care and deep-rooted. And so I'm just honored to have you on. I'm honored that you took the time today, because we connected on so many levels. And for me, it's sharing my story, my husband. I don't want another dentist who has a family, 2 young children, die because of this information, because I've tiptoed around it. I've been told some people have had death, threats because they're bringing this up about amalgams and mercury, So I'm not being quiet anymore. This happened to my family, and I know it could possibly happen to somebody else's family, and they're being lost in the system. So just check your heavy metals. You're a provider right now. You've been working with amalgams. Check. It's worth it. Right.
Yeah.
And it's worth it for your family. And if they're planning on having kids,
that's the most important part too.
Yes. What do you want to pass on to your children? I know in my book, I talk about if you're planning to have kids, as a wife and husband, start detoxing at least 3 to 6 months prior. Let the toxins, because that's what you're passing on. Unfortunately, that's
no,
the
100%. Yeah, no, and I love your passion. That's why we connect, because this is a passion of mine. And my whole thing is to dentists. I'm like, just listen. Like, if I'm doing it and you could see everything, just follow it. Like, there's no reason why not to follow it. Either you're gonna be as successful or more successful, and I want you to be more successful, right? That's
and
the
I
goal,
think. Do you think it's
right?
an identity thing? Because I know there's
It
it's
is.
what they've been taught and what they've been doing. And almost like for you, it's like, oh, I did something wrong, and that would be kind of create some shame or guilt, but it's okay. You did the best you could. Like you said, there's a time and place for root canals, but now we know more. And now, like, you do the ceramic implants, right?
Correct.
And so, those cost more, but it's your ethics too, right? You know what you're putting in the mouth. It's not another titanium metal. And so it also comes back to the why you became a dentist for the first point, and continue that purpose. If shifted now, the industry is shifting. And I love that. Actually, we've got to mention, I did mention it in the intro, but you're going to be part of the documentary by Old Dentistry. And I was so excited about this when Anthony showed me this, when I got invited to Shield documentary in Cannes. Then he shows me the dentistry. I said, that's it. I have to be there, because I know I'm part of the shift. And in fact, this week I got on a meeting, and they're going to put me part of the documentary as well.
Awesome. Yeah, because I spoke to them about it. Okay, awesome.
I did. I had last week, and they told me that they were done filming. And I was like, oh, I really felt like I needed to be on there. And then finally, I just reached out one more time. Worth asking. And I said, here's my story, and here's why I think it's imperative that I can reach globally, and I do feel to be part of this shift. And so I will be.
I'm glad you're on board. I'm glad, because they started off a very small, like, hey, let's record a surgery, and then it blossomed into this whole thing, right? So the idea started from like a very tiny little thing, because we just had mutual patients who were at the right place at the right time. Again, it just all connects the dots.
Well, yeah, like
And then,
even how like, for example, I didn't meet you because I was podcasting the first day in cons, and then it was the premiere, and I really didn't see you. There's 300 and some people. And
correct.
I knew there was a boat event, a big yacht event, and we had the choice to choose that. And I was like, oh my gosh, it'd be such a great experience. But then I was like, I don't know, should we do something else? I just prayed on it. And actually, I get these little signs when I pray on it. I get little signs, and I saw this little video of I'm like, that's my sign. I need to be on there. And I go on this boat, and the first I meet, actually, while we were looking for this boat, I meet you and Dr. Karandi. And then I go on this boat, and half the boat are dentists.
Yeah.
I was like, okay, God, I see where you want me.
Yep, exactly. No, and I wasn't going to go on it either. And Dr. Karandi was like, hey, just go. I'm like, okay, because I had other friends there. I was like, hey, can I hang out? And then all these plans and shifted. So he's like, hey, just go. I'm like, okay, I'll just go. And then we met.
Yeah, and then we met. So there's no coincidence that we met. I'll have Dr. Grande on as well. Really loved connecting with him. I'll have the Eva as well, and the check. And I was just so connected. And there's something about interpersonal, face-to-face, where we could talk. You get to meet my family. You get to see my big why. This is not, I'm not doing this for the lights, the cameras, the show. This I'm utilizing as a platform I can reach more globally. And I know that. And then same being on this documentary will allow me to reach many more globally, worldwide. And I'm so grateful to be part of this team. So I feel like we could talk forever. Maybe we'll connect again another time. Maybe through my surgery, we could document that.
Absolutely. We could film it. We could talk about it. You'll follow with Jeremy in a few weeks. So
it'll be so good. But if people want to come fly in to work with you, you're in Long Island, maybe, give out your information. We'll have it in the show notes, but tell people how they can follow you.
Yeah, they can go to toothandbody.com, and then the handle they can follow is Dr. DRJ, and then Gandhi, Gandhi. So Dr. J Gandhi. Yeah, that's the Instagram and the Twitter and all the handles.
Yeah, I love the information.
Toothandbody.com has all the videos and everything, explains everything there. So
I love that. Well, it's such an honor, and I can't wait to see you again and see your incredible work, and I hope you keep yourself so strong, connected to just do this work. It's incredible work that you're doing, and you're saving people's lives. And I am so honored to call you now a friend, so that I can just speed dial when I need to.
Yes, absolutely. Thank you for spreading the word, because we need people like you spreading this. So, and I'm glad you're on the documentary, because I spoke with Anthony about it. So I'm glad.
Okay, great. Yes, I'm deeply honored. Yeah, we're shooting in October, so I'm really excited.
Which is great. Thank you.
All right. Thank you so much.